Well, AI tools are available to help with daily tasks, including therapy. Question is, can they replace professional human care? Dr. Samra Zafar is here with more on the subject. Good morning.
Good morning. Good to see you again.
Great to have you with us. Very fascinating topic. And I want to ask you first, what types of AI tools are available right now for mental health support?
So there are lots of tools available, Corey. Like you have chatbots, mental health apps that can provide guidance, reflection prompts, coping strategies. But it's really important to know that they do not replace trained mental health professionals or human connection. So I work in psychiatry, and from a psychiatry standpoint, therapy involves assessment over time. So you're noticing the patterns, the risk factors, the trauma history, the medical contributors, the subtle changes in functioning. AI tools don't have access to that full clinical picture. It just responds to what you type. So whereas clinicians who are trained respond to what you say, what you avoid, your tone, your emotions, and your entire history. So these tools can be helpful for things like check-ins, stress tracking, journaling. Perhaps you want to articulate how to say something to your therapist, and they can help you find the words. They can work as a supplement to therapy, but not a replacement for a professional evaluation or ongoing care. So it might help you journal about anxiety, but it can't recognize when anxiety is actually masking depression, trauma, or burnout. So think of it as another tool in your mental health toolkit. So they can support your mental health journey, but they're not a substitute for human guidance that keeps you safe and keeps you feeling understood. So they can reflect your words back to you, but it can't really read between the lines that the way a trained clinician can.
Okay, so who can benefit most from these AI tools?
So people who are, let's say, struggling to find the words to say what they want to say to their therapist. People who perhaps, need an extra support. So you have like in between sessions, in between your therapy sessions, you need somebody to talk to at 2 a.m. You need to like vent about your feelings. You can't call a friend. You can't call a therapist. It's a good way to journal, and the journal that kind of reflects back to you instead of just you writing in there and then kind of finding out what you wrote later. So, and there are some limitations. So like, things that are full risk assessment requires clinical judgment. So AI doesn't know when you're minimizing your pain or hiding your vulnerability. We are trained to notice that. So if somebody is struggling with persistent or distressing feelings of feeling unsafe, that's not a moment for technology. It's a moment for professional care. So we have to look at the holistic picture, and it's not a replacement for that human judgment. However, it does have its place. It can be a supplement. And so if you're experiencing persistent symptoms of anxiety, depression, suicidal thoughts, then seek help immediately, because there are limitations to what AI can do. However, in those in-between moments, if you're just needing to vent, if you're just needing to talk things through and articulate how you're going to say something to your therapist or journal, then yes, the tools can have their place.
And are there situations where these AI tools are not appropriate?
Yes, absolutely. So if you're experiencing, like I said, persistent symptoms, for instance, you have two or more weeks of depressive symptoms that are really debilitating your life, or you're having suicidal thoughts, or let's say you're, hearing voices, or you're starting to believe in things. What we see right now, a lot of news about AI hallucinations. So you're starting to think, oh, what I'm being told, is it true or not? Or people are starting to question your beliefs. Say, hey, listen, you're starting to get a little bit too out of your normal things, and you're talking a little bit abnormally now based on how you normally are. Those are things to pay attention to. So make sure that you're not using it for diagnosis, for crisis intervention, for treatment. You need to seek help from a qualified professional in those cases immediately.
Perfect. Such a fascinating conversation. Thank you so much for bringing it to us this morning.
Yes, absolutely. So remember, mild stress, emotional organization, reflection, preparation for therapy sessions, great. But ongoing depression, anxiety, other mental health concerns, trauma, safety concerns, not okay. Seek professional help.
Sounds good. And if you'd like to connect with Dr. Zafar, check out samrazafar.com.